Okay, so I'm just talking about shock for a little bit, waiting for some more people to get in, and then we'll go ahead and get started. Let's see here. Hello. There she is. Just waiting for more people to pop in. Thank you, thank you. Let's see here. Oh, just waiting for more people to pop in, then we'll get started. I'll probably have maybe 10 minutes to talk about this before I gotta go for the night. I already made a video talking about this. Thank you for sharing that. Appreciate you. Just uploaded a YouTube video, not this style, but very similar. See if you can see the cursor. You should be able to see the cursor, but I think it disappeared. Let's see if I can fix it. Let's see. Capture cursor. There we go. Ah, there we go. Now you can see the cursor. You think, thank me with an Uncrustable. What flavor? What flavor are you looking for? Strawberry, apple cinnamon. Thank you in advance. Yes, I got you. I gotcha. Okay, so we're talking about the four main categories of shock. I'll wait for others to get in. Let's just go over the four main categories. You have cardiogenic, hypovolemic, distributive, and obstructive. Those are the four main top categories of shock. Cardiogenic, hypovolemic, distributive, and obstructive shock. Remember, the shock is either a pump, a volume, or a tone problem. Tone as in vasculature, as in the blood vessels. Okay. So shock is one of those three things. Cardiogenic is the pump, hypovolemic is the volume, distributive is the tone, and obstructive kind of falls in the category of the pump having issues, more like a back blockage, etc. Dang, how many times did you share the freaking live, EMS Barbie? Appreciate that. Okay. So back to it then, right? So cardiogenic is the pump problem. The heart fails to pump blood efficiently. Oh, I can see that. I can see you shared it many, many times. My cat is trying to make an appearance to say hello. Oh, I appreciate that. You must connect. I heart you too. Here, my cat wants to say hi. I barely see her with the screen. Now, she's going to climb all over me, so I have to get rid of her. And yes, I am repping Medics After Dark gear. Oh my gosh, she is annoying. Be gone. Okay, I am repping Medics After. You didn't see that. You didn't see any of that, Sean. If it is Sean right now. Okay, so cardiogenic is the heart's failing to pump blood. Think myocardial infarction, heart attack, ACS, acute coronary syndrome. The heart can be heart failure as well. Right-sided, left-sided. Sean, it is fantastic. Right-sided, left-sided. Does not matter. Heart failure, different kind of arrhythmias, MI, myocardial infarction, AMI, acute myocardial infarction. Not one that you want to flirt with. One that is acute, so it happens all of a sudden. Okay, so things you're going to see is chest pain, pulmonary edema. That's more so with left-sided heart failure. You're going to have weak pulse because it's being not producing enough blood volume out there. You're not pushing enough blood. Hypotension, which goes along with the weak pulse, pale, cool, and clammy skin, which is your body reacting to try and shunt blood, for layman's terms, back to the heart. And dyspnea, that goes along with just not having oxygen. Okay, so that's the main category of shock. Cardiogenic, as an EMT, this is NREMT standards. Again, this is NREMT standards. The way we manage this as an NREMT is if it's ACS, acute coronary syndrome, and we recognize it's chest pain, non-traumatic, if they are not allergic, you can give up to 4 low-dose aspirin. 81 milligrams times 4 is 324 milligrams of low-dose aspirin. Have the patient chew it. Chew, 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 chew. They can swallow it, but do not give them water. Okay, it's best to absorb in the buccal area in the mouth. It's one of the best areas for it to absorb because as it breaks down and absorbs in the vessels, where does those vessels go? Back to the heart, and takes a really strong effect there. Okay, instead of having to go through the whole GI system, swallowing it to actually digest it takes a lot longer. You can go through straight back to the blood vessels. Fantastic. That's why you got to take care of your oral health as well, because your oral health is linked directly to your heart health. Clean your damn teeth, you nasties. Brush twice a day and floss daily if you can remember. And use mouthwash, it's good for you. Clean that tongue. What is up, my guys? Oh. What the heck? Appeal. And change your socks, yes. So hold on, I got a notice saying my content's unoriginal, even though I made this. Change your socks. Let's see here. Submit. Nice sweatshirt, thanks. I got it from Nice Business. Okay, so that's cardiogenic shock. As far as nitroglycerin, 0.4 milligrams sublingual, you must, I repeat, you must go through the full patient assessment first as an NREMT. Okay, go through the full patient assessment. Verify that they have it prescribed to them. It's not expired. Make sure you get a full set of vital signs on them to include, I repeat, to include blood pressure. Blood pressure is super, super important, because if the blood pressure systolic is less than 90 or 100, different schools of thought had to say 100, you cannot give nitroglycerin, because nitroglycerin acts as a vasodilator. It's going to dilate those vessels. Okay, if you want a good description of what's happening, make a fist. That's your heart, approximately. Put a thumb up. That's the ascending aorta, and the descending comes out the bottom side. Overlie that, and those are the coronary arteries feeding that heart muscle. One of these coronary arteries is blocked or restricted or constricted, whatever you want to say, and it is restricting blood flow. Your heart's freaking the frick out. It's like, oh my gosh, I need blood. Send me blood. Help, help, I'm dying. So what that will do is going to dilate that blood vessel and make it so blood can get back into that heart muscle if it's not already dead. If it is angina pectoris, where it's just freaking the fuck out, usually nitroglycerin will help. If it is a true MI, myocardial infarction, infarction means death. It means it's already dead. It means it's not going to get any better no matter how much nitroglycerin you give them. Okay? It's dead. Okay? That's a good way to tell between angina pectoris and MI after you give medication. I kind of talked about that a little bit. Another thing you need to check for is sexual dysfunction medications. Make sure they are not taken any in the past 48 to 72 hours. Okay, you have common ones like Viagra, Cialis, and Levitra that you might see. Make sure you ask them, have you taken any of these medications in the past 3 days? That's the best way to do it, past 3 days. If they have, consult with your medical provider. Usually Viagra is okay if it's been more than 24 hours, 24 to 48 hours, but you want to monitor it very, very carefully. Another reason we need to make sure the medication is theirs, prescribed already, is because, so how I learned it, if it is the right-sided MI, it could cause severe or it could cause a drop in blood pressure. Blood pressure can drop very rapidly, and you can have a lot of issues. Not good. It can drop the blood pressure more and put them in the worst state of shock. So I'm going to move past the cardiogenic, because I kind of talked about that for out the ass, because I love talking about the heart. What is up, peoples? Hypovolemic shock, low, volemic, volume. You're in shock because you have low volume of something. Hello, Strawberry Chaos. It's typically blood, if it's more specific, of hemorrhagic, as it shows right here. Hemorrhagic blood. Hemorrhagic shock is blood loss. Severe dehydration is hypovolemic shock. Things you might see: tachycardia, weak, thready pulse. Weak and thready pretty much mean the same thing. Hypotension is a very late sign. Pale, cool, and diaphoretic. Thirst, altered mental status. The thirst is because they are dehydrated. They are low in fluids. They need more fluids. Oh my gosh. Surprise, surprise. I am not surprised. Okay. Way to stop that or help that out is, if they're bleeding, stop the freaking bleed. Stop the bleed. Okay? That's not that hard. If they're bleeding, direct pressure as an EMT. Direct pressure is first and often the foremost way to stop bleeding. And then if that does not work, tourniquets. Okay, if it's life-threatening bleeding, stop the bleed. But as per NREMT standards, you must, I repeat, you must use direct pressure first. Sounds like my wife's home. I don't have much longer in here before I got to go help out with some things she got from the store. So maybe like 5 minutes or so. stop the bleed, stop the bleed, stop the bleed, and transport rapidly. They get the LSD, the light siren, and the diesel. Okay. Another thing to look for is distributive shock. Distributed is widespread vasodilation. A good analogy I like to use for distributive shock is, who knows what the redneck foot wash is? Take one of those plastic kiddie pools, fill it with water, and shake it. If you take a plastic kiddie pool, fill it with water, and shake it, a lot of pressure is going to be hitting the walls. That is your blood vessels under normal size, with blood filling it up and having good adequate pressure along the whole spectrum of it. Whenever you go into distributive shock, that whole thing gets bigger, much bigger. Okay, not this big, but pretty big. I mean, that's huge, some might say. Some might say too big. Okay. What happens is you have the same volume of blood. Appreciate the follows there. Appreciate all the likes. You have the same volume of blood, but it's in a much bigger space. So it's going to drop your blood pressure. Okay, it's going to drop that blood pressure. And 3 of the main types of distributive shock you might see is septic, anaphylactic, and neurogenic. Septic is a systemic infection. Usually starts off like UTI, pneumonia, some kind of localized infection that's not treated properly. That's why if you get prescribed antibiotics, you must take them fully. Do not stop them when you feel better. You need to have good antibiotic stewardship. So septic shock, not static shock, septic shock, it affects the whole body. Okay, you're going to see a tank in blood pressure. If someone is in hospital, if you're a higher level provider and you can do IVs, you're going to see the blood pressure stay low even though you're giving plenty of fluids. That's a good sign. It might be septic shock as well. Anaphylactic, you're going to have a severe allergic reaction. It's going to affect more than just one body system. If someone gets stung by a bee and they have an itchy arm, as of right now, that is only allergic reaction. If it starts to affect two or more body systems, like stomach, like lightheadedness, that's when it becomes anaphylactic shock. Okay, anaphylaxis is 2 or more body systems. You might have signs of shock, so lightheaded, dizzy, poor perfusion, and or respiratory issues. If you have any of those 3 things, that is septic shock. Okay, septic shock. Give me 1 second. Okay, that's septic shock. Anaphylactic shock, my bad. Anaphylactic shock. Neurogenic shock is a spinal cord injury. You're going to have something called, you might see something called Cushing's triad or Cushing's reflex. That's whenever everything from the injury down gets all jacked up. It cannot control it well. It's going to be all fucked up, in lieu of other terms. You're going to have differing body temperatures. That's why when you're checking for CCT, color condition temperature, you use the back of the hand on the forehead and the abdomen. You check 2 different areas to see how it feels. Okay. What we can do for that, for septic shock, is LSD, light siren, diesel. Anaphylaxis is treated with an epinephrine autoinjector if it's available and per your protocols. And the neurogenic shock, maintain C-spine stabilization and GTFO. Hi, Betty. My dog's coming to say hi. You can't see her probably though, because of my blacked out screen. Hi. Good girl. And then obstructive shock. That's when things are blocked. Mechanism blocks it, prevents heart function. 3 main causes of it is tension pneumothorax, cardiac tamponade, and pulmonary embolism. What is up here? Pulmonary embolism. So these 3 things could cause obstructive shock. Do not get confused. Do not overcomplicate it. Tension pneumothorax is just shock from a pneumothorax. It's not that complicated. So you have error in the pleural space collapsing that lung. Okay, errors in the pleural space collapsing that lung, and it's putting pressure transversely across the heart, probably compressing the superior and inferior vena cava, which restricts blood flow back into the heart, which is going to show signs of shock. That's why when you have that, I collapsed unconscious and had an irregular heartbeat the other week. Holy crap! Hope you're doing okay there, man. Like you went into cardiogenic shock. Damn, that's wild. That's lots of stress. Yeah, I bet. Lots of stress. Let's see here. What was I saying again? Tension pneumothorax is just shock from a pneumothorax. I'm glad you're alive and well, be able to be able. No, you're good, man. You're good. It goes along with what we're talking about. Perfectly fine. Cardiac tamponade occurs when you have your heart and you have a nice little sac that surrounds it called the pericardium. If that gets nicked or bleeds a little bit, it puts pressure inside there, putting pressure on the heart. Here's your heart contracting, beating, and the sac around it allows for smooth movement and protection. When that fills with blood, it constricts the movement, reduces blood flow. Okay, signs of that is called Beck's triad, B-E-C-K, Beck's in the pecs. Beck's in the pecs. You're probably going to have hypertension or narrowing pulse pressure. Probably going to have muffled heart sounds like you're listening through the heart through water. And you're probably going to have JVD, jugular vein distension. And then pulmonary embolism usually starts in DVT, deep vein thrombosis. So people that are pregnant, smokers, travel a lot, are stagnant jobs, are more prone to DVTs, deep vein thrombosis. It occurs typically in the in the calf. Your veins down there are very deep and have limited movement. You get a clot there called a thrombus, a deep vein thrombosis, a clot, and then when it moves, it becomes an embolus. It moves, and as it goes back to the heart, the vessels get bigger. As it travels back to the heart, the vessels get bigger, so it does not get stuck. So it goes into the right atrium, right ventricle just fine, but then it goes to the pulmonary artery, goes away from the heart, and it gets smaller. This is where it gets stuck. It gets stuck right around here. That's called a pulmonary, where the location's at, and embolism, a blood clot that moved from its original location. You may see JVD, like I said, bulging neck veins, muffled heart sounds, tracheal deviation. That's where the trachea goes off to one side. Okay, that's a very, very, very late sign. I have not seen that at all on live patients. Hypertension, low blood pressure, and tachycardia, fast heart rate, and dyspnea. Okay, if you have not followed already, if you see right here on my screen, it says join the Medics After Dark Discord. There is a link, and I'll put it in the comment here below too. Be sure to join the Discord. Oh, where'd it go? There it goes. Join the Discord. Thanks for the hearts, appreciate you. And the roses, thanks. Be sure to join the Discord if you want more content. You have more people in there that are EMS providers, EMTs, paramedics, firefighters, etc. It's a great community. Go ahead and join. For the time being, I have to go for the night. But thanks for joining and have a great, great day.